Welcome and thank you for standing by. At this time, all participants are in a listen-only mode until the question and answer session of the call. If you'd like to ask a question during that time, please press star followed by number 1. Today's conference is being recorded. Any objections, you may disconnect at this time. Now I'd like to turn over the conference to Maria Reed. Thank you. You may begin.
Thank you. Good afternoon, and thank you for joining today's webinar. My name is Maria Reed. I am the project manager for the Partnership for Food Protection and will serve as the moderator for today's call. PFP would like to recognize our co-hosts for today's webinar, Amy Chang and Chelsea Gridley-Smith from NACCHO, Stephen Mandernack from AFDO, David Dijak and Laura Wildy from NEHA. Today's call is scheduled for 90 minutes, with the first portion of the call being dedicated to presentations. Presenting today, we have Alexis Barajas from the Southern Nevada Health District, Douglas Dyer from the Seattle and King County Public Health Department, Rachel Stradling from the Alexandria Health Department in Virginia, Sandra Craig from the South Carolina Department of Health and Environmental Control, and Christopher Smith from the U.S. Food and Drug Administration. Following the presentations, we will open the phone lines and take questions from our callers during our question and answer session. I'd like to introduce Barbara Cassens, co-chairperson for the Partnership for Food Protection Governing Council. Barbara?
Hey, Maria, thank you. Good morning, good afternoon, everyone. This is Barbara Cassens. We're hosting this as a series of webinars. This is our second in a series. We plan to have a PFP face-to-face meeting this year, but of course the COVID pandemic changed our plans. So therefore we are experimenting with this format in collaboration with our association partners to deliver some information and to think about in the future of how the Partnership for Food Protection can engage, work on best practices, and to use some of this event as a learning tool and to improve our processes and procedures going forward. So I appreciate you for joining, and I'm going to turn it over to my colleague, Pat Kenley, co-chair of the Governing Council for the Partnership for Food Protection. Pat?
Thanks, Barbara. Just to expand a little bit on Barbara's point, we're very excited today to hear about some of the innovative approaches and adaptations that regulatory programs have had to make in this kind of very unique time that we're in. I don't think one of us looked at, down the road if we look back from, last year and looking forward, I don't think any of us contemplated, having any type of event similar to this that we might respond to. I mean, we prepare for hurricanes and earthquakes and flooding events and fires, but we don't ever really think about the pandemic because it's been so long since one's happened and how that's really going to impact our operations. And programs have had to really, adapt and modify their operations very quickly, not only to deal with the industry and ensure that consumers are continue to be exposed to, are not exposed to contaminated food, but also looking at our own staff safety issues as we put staff out in the field to ensure the safety of the food supply. We're hoping that these presentations will spark some ideas from some of the innovative approaches that folks have had. And we're also looking for ways, of course, that we can update, PFP best practices, that we can give tools to the programs that they can utilize in events like this. So on behalf of the Governing Council, I want to thank everyone for taking time out of their busy schedule to join the webinar today. With that, I'll turn it back over to Maria, and we'll start the presentations.
Thank you, Pat. Our first presenter today is Alexis Barajas from the Southern Nevada Health District. Alexis?
Hi, good morning and good afternoon for some. I wanted to tell you a little bit about what we've been doing in our environmental health department here in Las Vegas since the beginning of all this. Next slide, please. If I think back to the beginning of the year, what really we want to start with is the fact that our building had begun to reach capacity. So it made sense to our management that some of our field staff was going to start to begin to work from home rather than come into the office each day. And so when the stay-at-home order was declared, it actually was correlating to the Environmental Health Division conducting a remote work pilot program, and some of our field inspectors were already starting to work from home that very same week. So the plan initially was for that trial to go on for a few months and then to reevaluate. But instead, it turns out that all of our environmental health field staff began to work from home on March 13th, and some of the EH office staff began to work from home on March 16th. So this led to a little bit of difficulty with the need for additional laptops and cell phones and headsets, all that kind of thing. And then in addition to that, IT needing to keep track of everybody's equipment. So we had to get remote work agreements put together and sent out to everybody, in addition to equipment checkout agreements that went out to all of our staff. Around that same time, it was determined that some services provided at the health district were going to be considered non-essential, and we're going to close to the public, or we're going to be completely suspended. So environmental health services were reduced at that time also, specifically for like our plan review department. It also impacted mobile food, temporary food establishments, solid waste and compliance, in addition to pool inspections. All of those were suspended temporarily. Next slide, please. So the first few weeks of the stay-at-home order saw EH staff working on a lot of continuing education credits, office projects. We had people reassigned to other divisions of our health district. However, some field inspections were continuing, like for final approvals. Routine food inspections continued, in addition to emergency response, even though, as you can see by some of these pictures, like doors were closed all over town. It was pretty amazing. Like the Strip looked like a ghost town all of a sudden. We also got requests coming in to assist with evaluating food safety at food donation sites throughout the Valley and Clark County. In addition, our industry was asking for us for a lot of guidance. So we started working on documents about COVID-19 to be able to post up on our website, in addition to be able to email out to our industry partners. So our first informational email was sent out to our markets specifically. However, at this time, everything was basically going to be guidance because the health district was not asked to enforce any of these closure mandates. All enforcement was going to be through our business licensing and Nevada OSHA. Next slide, please. So this is a little snip from our website, and our first documents went online March 23rd. It covered general guidance for COVID-19, in addition to facilities that were going to be closing down because of the orders. However, we also had information based off of, good food science, but also relating it to COVID-19, and then guidance for industry as they were preparing to switch over for takeout or delivery only. And we also developed an employee health screening questionnaire that was specific to COVID-19 symptoms. We were getting a lot of questions related to grocery stores, since those were an essential business that remained open the entire time. And then also for what am I supposed to do if one of my employees tests positive for COVID-19. So those were two of the first documents that really was based on direct industry questions that we developed. And then we put together some other ones like no personal container sign, and then some guidelines if a business decided they did want to reopen, maybe as a takeout or a delivery only. And then a little later on, guidance on cloth face coverings. And also, just because we had the availability of our staff, in addition to doing these documents in English, our goal was also to have them all translated and posted in Spanish as well as Chinese, because that's the staff that we had available to do that kind of work. Next slide, please. So meanwhile, management decided that we, like I said, we're going to continue some of our routine inspections. However, at this time, we were not charging any downgrade fees or closure fees automatically. We put together a field guidance document for our field staff on how to continue in-person inspections. So it covered things like how to use PPE, keeping social distance, using hand sanitizer, or if it's just not possible to do a routine inspection, kind of guidance on how to switch over to doing an educational outreach survey instead. So around the same time, we were having to get all of our field staff fit tested for N95 respirators, which wound up taking a lot of time because, of course, other divisions were requesting the same thing at the same time. We also had staff reduction because some of our staff was going to assist these other programs. So, for example, some staff went to support the incident command structure, so they were helping make cloth face coverings, they were working in the community testing sites, or even just taking phone calls, either from the public requesting information, or in addition, anytime we received complaints, they would be taking those phone calls. And then other staff was going to support our Office of Epidemiology and Disease Surveillance. So these folks were helping with the contact tracing, with testing notification, and then even occasionally doing those delivery of notices in the field. Next slide, please. So meantime, some of our office staff was now having to address reopening of businesses. So we had staff continue to work on these projects from the office, update our guidance documents, which takes a lot of time to get the information reviewed, make sure it's matching up to the governor's mandates, whatever changes and progress we've made through CDC. So it was really a lot of time to then go through and get all these reopening business guidance documents together. So this is a snip of some examples of what we did for food establishments, a planning guide for reopening, and then in addition, how to operate during phase one for our food establishments. Next slide, please. And then we moved into phase two, the end of May. So some businesses remained closed at this time, including our large casino properties. It was going to be up to the Gaming Control Board to decide when those were going to reopen, but we did have some additional businesses that were reopening in phase two, but our restrictions were continuing from phase one. So just like before, all enforcement for the reopening was going to be through Gaming Control Board, in addition to business licensing and Nevada OSHA. And then around the same time, moving into June, management was asking field staff to focus more on completing routine inspections because basically what we were finding out is that our routine work had gone down a lot, even if we just compared it to April the year before. We were also given the go-ahead to start field training again, so that was good for us because we were excited to get our new people out in the field doing routine inspections again. And then meantime, behind the scenes, of course, we're still having to go through all those guidance documents and do updates. And then same with our field staff guidance document. We had to go through an update for the reportable symptoms, giving our staff the okay to leave a facility in order to complete the report if necessary. We waived the requirement to sign reports, so we included that in our guidance document. And then we made an announcement to our staff that food handler safety training cards were not going to be required through the end of the year, so we were not going to be enforcing that. Next slide, please. So we had also been asked to give some guidance to other types of businesses, and then, of course, environmental health takes care of a lot of other programs, not just food. So as more businesses started to open in phase two, we were pulling in different information to try to help all of those businesses meet the guidance of the mandates also. Next slide, please. So then finally, our casinos were allowed to reopen again on June 4th. The Gaming Control Board was going to require that all casinos submit to them a safety plan prior to reopening. And it also was going to have to be approved by the board before those facilities reopened. So that was really interesting. Basically, not every large casino or large operation decided to reopen all on the same day. They've also kind of decided to stagger their reopening. So even now, not every facility has reopened. It is also interesting to note that because no self-service of food is allowed under the current governor's mandate, that all buffets are required to serve the guests. There is no self-service there. And there's still no word on when conventions are going to return. It looks like everything's still canceled through October. And even though Allegiant Stadium, new home of the Raiders, is going through final inspections, even as we speak, We've got no word really on what the new season is going to look like there. Next slide, please. So really, there's still a lot of uncertainty going forward, even almost 5 months in, on what environmental health here at Southern Nevada Health District is going to look like. Like how are school inspections going to be done? We don't really know. We think fall will be starting up, but we don't know if that's going to include kitchens. We're not sure how we're going to handle inspections of facilities that remain closed by the governor's directive. We're considering creating a new inspection code to document the fact that the permit's there, but they have not been operating this year. And then now our annual inspection or our annual permits have gone out for renewal, but we don't exactly know how fees are going to get paid this year, so that'll be interesting to see. Next slide, please. Really, it's, I would guess, a lot of uncertainty for a lot of places throughout the country. Especially here, we're just not exactly sure if our role is going to continue as education only rather than enforcement of the directives. We've had the mask requirement come out here in our state. We found out that phase 3 has been delayed at least till the end of July. And so even still, some businesses are going to be remaining closed for a while. And we've had an upturn in cases, so that has affected some of our food establishments that reopened have been now asked to close again, such as bars, just last Friday at midnight. So we're just waiting and seeing a lot, just like everybody else, I suppose. Next slide, please. That's it. I will be here for questions until the end of the presentation, and of course, please visit our website if you have any interest in seeing our documents, or you can contact me. Thank you.
Thank you, Alexis. Our next speaker is Douglas Blair from the Seattle and King County Public Health Department. Doug?
Good morning and afternoon, everyone, and thank you to the sponsors for putting together this webinar. What I want to do for the next few minutes is just talk about a virtual food safety assessment program that we developed at Public Health Seattle and King County, and why it really feels like, as our director so aptly puts it, we're building the plane and we're flying it to you at the same time. So next slide. Next slide, please. Quick geography. So we're obviously in the state of Washington. King County is in the Puget Sound region, and the city of Seattle is the biggest city within the county. Next slide. And I would be remiss if I didn't have the requisite photos of Pike Place Market and the Space Needle and, of course, the waterfront. Next slide. I'd like to acknowledge, most importantly, our constituents. So those folks in the regulated community that we work with and their flexibility during what amounts to real trying times, of course, particularly for food operators, water recreation facilities, and the like. To our staff at Public Health Seattle King County, who continue to amaze me every day with the skill set they have in things outside of normal regulatory work, like putting together this virtual food safety assessment program. And then also, I want to give a shout out to South Carolina's Department of Health and Environmental Control, because really it was a video they created in their program that really sort of inspired us to move forward with this. Next slide. So why do a virtual food safety assessment? Well, it was really born out of necessity. Early in March, and as most of you may recall from watching the news, actually going back to late January, early February, we're starting to see something quite unusual in the state of Washington: an upper respiratory illness, mortality among elderly folks. And so really born out of necessity and our King County executives' order to mandate work from home for public health employees, we needed to figure out a way that we were going to be able to adequately reach out to our regulated community. And at the same time, we wanted to be sure that we could minimize any risk to our staff of acquiring COVID-19. We have a broad range of staff and across a broad scale of age ranges, and we wanted to make sure everyone was equally protected. At the same time, we always feel it's important for us to have a presence with our operators, not only to, of course, make sure that we're protecting public health in the realm of food safety, but also to help educate them. And being that we're a fee-supported program, we also feel accountable to our regulated community as well. Next slide. So, in developing a framework for developing a virtual food safety assessment program, I mentioned South Carolina's program, but also we had kind of been experimenting a little bit. Our plan reviewers had been experimenting with doing basically a virtual plan review. So doing a sort of field walkthrough virtually via an app-based program like Skype or FaceTime or something like that for food establishments that weren't necessarily complex ones, but more like coffee shops where you might have a less significant amount of equipment and less focus on finishes and that sort of thing. And so from that, we sort of pivoted into thinking about how can we broadly develop a virtual food safety assessment that really takes into account some of the skill sets we had internally. So we had investigators who had dabbled a little bit in video production and had some knowledge in app-based communication channels, and also being able to modify our inspection software a little bit to reflect some meaningful information that potentially would be an outcome of doing these. Next slide. So of those challenges, sort of the theoretical challenges we thought about before actually implementing it is we needed to think about how could we kind of hybridize two things. One is we wanted to make sure we were still doing some sort of assessment on foodborne illness risk factors, but of those foodborne illness risk factors that we think about, which ones are most sort of relatable to the concept of dealing with a pandemic, and a pandemic that's not necessarily foodborne. So what we did was we took into account the sort of guidelines, I think, that most states have adopted nationwide in things like social distancing and face coverings and hand hygiene and being mindful of one's personal health, in combination with foodborne illness risk factors like employee health and hygiene, like hand washing, like demonstration by the person in charge, as well as cleaning and sanitizing, ensuring that folks understand how to properly clean and sanitize, the right types of concentrations of sanitizer, and then even getting into the realm of the difference between sanitizing and disinfecting. So basically that's what we did, is we sort of picked the most relatable foodborne illness risk factors in combination with the best practices for minimizing the spread of COVID-19, and that became the foundation for doing these food safety assessments. We also understood that you only have a limited amount of time to capture an operator's attention, so we had to be mindful of that, trying to keep it to something manageable, like somewhere around 15 minutes to a half hour, and I know that may sound relatively short, but at the same time, we needed to make sure that we, at least in some manner, were able to reach out and keep people's attention. For us, there's a little bit of a challenge, too, when it comes to actually doing the inspection and how that gets entered into our database, because we have a restaurant rating program in King County, so we have a placarding program. And what we decided is we're not going to penalize people doing food safety assessments during a pandemic, so we temporarily put a halt to any sort of ratings. And then we also had to be mindful that when we entered data, we wanted to make sure that we could extract it in a meaningful way. And then finally, wanting to make sure, too, we understood that not all operators may have access to technology. Now, since then, we've pivoted to being able to get back out in the field with precautions. However, there's still an option for our staff to do virtual food safety assessments, and we have operators who are motivated to do them. Next slide. So in practice, some of the challenges included operators were reluctant when first contacted to even participate because they didn't think it was the health department calling them. So I heard from a couple of our investigators, it was just a challenge to try to convince an operator that indeed this is the health department, this is what we're doing due to these unusual times. And so there was, some hesitancy on their behalf. It is a little difficult with restaurants that are chronic underperformers. So as we all know, doing routine food inspections is really an exercise in interpersonal communication. So a food virtual assessment isn't necessarily the best, but it's the tool we had at the time. Communication can be somewhat inhibited by face covering, so sometimes there was difficulty in understanding folks that we were doing the assessment with. Language barriers, which of course can be universal even in the best of times. And then emphasizing corrective actions through demonstration. So sometimes if you're not there in person, it's really hard to help an operator understand a concept, like, for example, mixing the right concentration of sanitizer in a 3-compartment sink. And then even though we tried to prepare operators the best we could ahead of time, and I'll show you the web link we have for those tools, sometimes they still didn't have, for example, a thermometer that was calibrated correctly, or even having test strips to check sanitizer. Next slide. On the upside, what operators appreciated was it gave them an opportunity to set aside a block of time to ask some questions about COVID-19 that allowed them to become more aware of how the disease sort of acts and why it's important to do things like distancing, face covering, and being mindful of one's personal health. And then about 70% of the operators we contacted, they were interested in it and they wanted to give it a try. It also gave us a way to coach on key foodborne illness risk factors in maybe a less stressful way. So with some separation, I think operators actually felt a little bit more comfortable and less intimidated. And then it also allowed them to do some hands-on stuff during the assessment. So they're the ones who get to use the thermometer, and they're the ones that are using the test strips. And we'd like people to do that anyways, but we know during normal times that doesn't necessarily happen. It can be a little passive, and they're just walking through with the investigator, watching what the investigator's doing. Next slide. So if we can click on that link, hopefully it works. And if not, at least I think this will be recorded so folks can go back and look at it. But we have set up a page that has a demonstration video, and it has a toolkit for operators to prepare them ahead of time for the virtual food safety assessment. The State of Washington Department of Health also has put together a really great toolkit for local health jurisdictions across the state to work with operators so that they can be well prepared and think about things going forward. And from this was born quite a few useful documents, which I think will really help convey the message about a person in charge and what knowledge they not only need to demonstrate to us as health inspectors, but what they should be doing every day when we're not there. Next slide. So obviously we're going to reserve time at the end for questions, so I look forward to any you might have. And I glossed over this fairly quickly. It took quite a bit of work by a fairly good-sized team in our program, but I just want to thank them for the great work they did and how they really vetted it. And hopefully from this, there may be some tools in the future that we can utilize once we've sort of gotten past this and more to a normal operating mode that could help in the overall education of minimizing foodborne illness risk factors. Thank you.
Thank you. Next up, we have Rachel Stradling from the Alexandra Health Department.
So thank you for inviting me here today. I wanted to talk to you a little bit about our ALX Promise program. It's slightly different to the other presenters in that it's more focused on what we were doing with our businesses. Next slide. So I wanted to start off by giving a bit of a quick overview of the timeline of how events happened in Northern Virginia. So we started off on, obviously, March 12th with the declared state of emergency. The first step with regards to our phase closing was the restriction for the number of people that were able to be on site to 10 people. we quickly went to a no-person inspection on March 18th. At the same time, we were starting to brainstorm with our businesses how we could develop some kind of health department seal. The one thing that the businesses really wanted to tell their customers was that they weren't putting profit before safety, that they really were focused on trying to, do whatever it took to stay open, but to keep their customers safe. Unfortunately, we quickly went from having 10 people on site to having no people on site. And on March 24th, all of the dining and congregation areas within Virginia were closed. So we went into kind of a holding pattern up until May, when the governor lifted our restrictions and moved us into phase 1. So Northern Virginia moved into phase 1 on May 20th, and we launched our ALX Promise program on May 21st. The interesting thing was we went from regulating just restaurants and pools and the usual kind of environmental health programs to actually monitoring the phased reopening for all businesses within Alexandria. So our workload went from about 1,000 businesses that we routinely visited to about 5,000 businesses that we'd never had any contact with before. Next slide. So what is the ALX Promise? It's basically a voluntary program that we created to help our businesses to reopen safely, created in a response very much to the confusion over the requirements and our businesses being very fearful to reopen. And it also helped to reassure our public that Alexandria was not putting profit before safety. Next slide. So the basic components of our ALX Promise scheme were initially the businesses would all register to participate in the voluntary scheme through a website. So once they had registered, one of my awesome environmental health team would then reach out to them to schedule a one-to-one consultation. We also did some group consultations with light businesses, but the key focus of that initial step was really to give the businesses the education, support, and tools that they needed for that safe reopening. It was a consultation, a two-way conversation to discuss what their concerns were and also to discuss what the requirements of the reopening were. So next, we helped them to make sure that all of their employees were trained. So we gave them training materials, training checklists, all designed to make sure that they had everything that they could possibly need for the training of their staff. Because without the staff fully engaging in the process and wearing the face coverings, washing their hands, we wouldn't get the safe reopening that we all strongly desired. So the next part of the promise was to make sure that we got that feedback and the promise from the businesses that they would do the right thing. So in order to do that, they completed a checklist. The checklist was something that we created for them based on the mandatory and best practice requirements for that particular phase of reopening. And I have to give a shout out to my amazing team who managed to create checklists for every business sector in record time, which was an amazing feat. So we also gave them a training record, and then there was a pledge that they committed to. So the pledge was basically to do the right thing, to open slowly, to educate their staff, to wear face coverings, and then that commitment was to extend into, at that stage we're in phase 1, so for phase 2, phase 3, and hopefully if we get there, phase 4. Next slide. So the training tools that we gave to all of our restaurants, so the idea was that we would give them that initial training, the business owner, but they would then go away and use all of the training tools that we created to train their staff. So the things that we gave them, we created PowerPoint presentations, we created YouTube videos, or initially we saw other people's YouTube videos, which we utilized and fully credited the people that had created them. But later on, as we were getting a little bit more savvy, the city of Alexandria actually helped us to create videos that were branded. And I'd hope to show you some today, but unfortunately the technology doesn't allow that. So I've put the links up, so hopefully you can have a look at them later. So the training covered obviously the 4 really key prevention strategies, which were face coverings, which we later updated to reflect its mandatory status, social distancing, hand washing, and just general cleaning and disinfection. And obviously the advice and information in the training program changed as we moved through the phases. We also gave them signage. So the signage is all on a website, so they can literally go to a website and they can print the signage out. For those businesses that didn't have access to printers, my amazing team and a team of volunteers actually printed the signage out for them and dropped it off at their businesses in a really good socially distanced way. Next slide. So this is just a video about how to make and use a cloth face covering, which is one of the key components of our training. Next slide. And then we created a video, the 6 steps to stopping the spread. This one was community-based, but it's got some really excellent education materials in it. We actually translated it into English, Spanish, Amharic, and I think Arabic too, but I didn't have space for the link for that one as well. Next slide. So one thing we noticed as we were progressing with our ALX Promise program, it's voluntary. So in order to get the message out, unfortunately, I had to do a huge media campaign. So some of the team noticed that we weren't getting participation in some of our areas, which are lower income, more ethnic minority areas. So we actually decided that we were going to map participation. And it's not that clear from this slide, but basically we have a high density of people participating, which are the colored dots in our Old Town area, which is full of higher end restaurants and higher end businesses. And it's a very affluent area within the city. You'll notice we have a lot of white dots. So those white dots are our areas where our SWAM vendors are registered. And you'll notice that there is a lower participation where those white dots are. So next slide. So in order to address this inequity, the next stage of our ALX Promise program is definitely to target our outreach in the areas where our SWAM businesses are located. So as part of that, we're mailing out postcards, and MRC volunteers are taking to the street to do actual outreach with them as well. We have some interviews lined up with Spanish radio, and one of our EHS specialists is going to be working on that project because I don't speak Spanish, and more media, obviously, as well. So lots more of Rachel on the TV, unfortunately. I am not somebody that naturally likes being on the TV, but I've learned to live with it. So hopefully that will help us to address some of the inequity issues that we're seeing in the participation levels. Next slide. Okay, so some of the takeaways for me. The one thing that my team all expressed at the start of our response to the COVID pandemic was that they really needed to help our community. And this program really made us feel like we were making a difference. We're interacting with businesses that we've never spoken to before, and we're getting really positive feedback from them. The nice thing is, because we set up the one-to-one consultations at the start, the businesses feel that they have somebody to come back to when they have new concerns. So that interaction and communication has been amazing. Hopefully those relationships will last into the future and long beyond COVID. And we were definitely adapting a we're in this together approach. And that's the basis of all of our messaging to our businesses. Next slide. And thank you for inviting me to speak today.
Thank you, Alexis. Rachel, I'm sorry. Next up, we have Sandra Craig from the South Carolina Department of Health and Environmental Control. Sandra?
Good afternoon, everyone. Glad to be back to talking to some of you again. Some of you may have already heard my spiel, but I'm going to run through this pretty quick. Next slide, please. How we got started in this is pretty much like everybody else has, what you've already heard. We were going along, life was good, and then all of a sudden one day the governor decided to close the state and tell us all to stay home and work virtually. And we had people out there that needed permit inspections, and one contractor reached out to one of our food team leaders and said, what can we do? I've got to get this place open. I've got to get a permit. And at that time, we were not allowed to go out in the field. So he asked if we could do it FaceTime. And that team leader called over to the central office. We are a statewide program, so he consulted with us. And we said, well, let's give it a try. Let's see what happens. So we tried it as a pilot. Next slide, please. And basically, it worked. We did the one inspection. We saw that we had him take us around with his camera, with his FaceTime. He showed us everything we needed to see. We developed some disclaimer language that we would put on the inspection form that said, you know, if I didn't see it this time, when I come back for real and I mark it then, it's going to count, because our regulation does require 100% compliance before we issue a permit. So we gave ourselves some breathing space there. And we also had to develop an acknowledgement of the inspection document, because we weren't going to be there to get signatures. Next slide, please. So once we got through that and we got our little permit thing set up, our virtual permit SOP set up, we said, well, what else can we do? Because now we were sitting there not able to do routine inspections or any type of inspections, and all we were doing was giving phone calls to people and say, how are you doing? Are you open? What's going on? So we thought about the virtual, and we said, okay, let's try this. Let's develop a non-scored, because we knew we weren't going to be able to go out there and change grades. And plus, at that time, quite honestly, we didn't think anybody needed us coming out there to put a C on their door. So we developed a non-scored, risk factor-based, what we called a food safety check. It allowed us to do our social distancing. It let us do the basic food safety information that everybody needed to be doing takeout, because that's all anybody was doing at that time, takeout and delivery. Again, very focused on compliance assistance and education. At that time, that's what everybody needed. And then we developed our guidance tools, very similar to what everybody else developed. But the good feature of these food safety checks were they took about 30 minutes. Some of them could take longer, but generally they were about 30 minutes to complete. Next slide, please. A real key to doing this was to create a separate electronic form in our reporting system, because we did not want it to look like our regular inspection form. We did want it to be distinctly different. There were questions on there that we normally wouldn't ask about, are you doing takeout? What are you doing right now? There were also things on there about COVID-19 that are not in our regulation at all. So that it gave us the flexibility to do those things. And we narrowed it down to our major risk factors. We were concentrating on risk factors, and still are. We very much removed all the good retail practices. Our questions on our form are conditional. So it's a drop-down, and the inspector can still put in comments as needed on the questions. So we're very fortunate to have a very flexible and manageable electronic reporting system that allowed this to be very successful. Next slide, please. So we did those through the end of June. But coming toward the end of June, as things opened back up, outdoor dining had opened up, we had limited indoor dining, we felt like it was time to step up our game. So even though the food safety checks were great and they served a good purpose, we wanted to step it up, and so we've created now what we call our limited scope inspections. It's still not a routine inspection. We still cannot do enforcement based on it, but we've stepped up our game, and now it's a pass-fail instead of just saying completed. Now, again, you've really got to try hard to fail, because you got to have 3 or more things that cannot be corrected during the virtual conference to fail. And basically, if somebody failed more than once, it would trigger us to have to go out and do some things. But we've also found on these inspections, and we have found some stuff. We did one virtual inspection where the refrigeration was out. We have found that the operators have been very open and have done voluntary closures for us, so we haven't had to go out and force a closure. They've been very responsive. Next slide, please. The good thing about virtual inspections is it allows us to be interactive and focused on those risk factors, and the fact that we can encompass things more than what's in our food code. It also provides that reassurance to the consumer that we are doing something, that we are checking up on people, that we are making sure that food is still safe. Even though it's not a graded inspection, we are still looking at them, and that's why we stepped up to the pass-fail, to give just a little bit more oomph to it. It also is we have a program here in South Carolina very similar to the one that you just heard about. Ours is called Pal-Mel Priority, and it's operated by our South Carolina Restaurant and Lodging Association. But they have made having a food safety check or a limited scope inspection part of their educational requirements for that program. They also require that people applying for that program take the ServSafe COVID training. So that gives it is an assurance that people are operating under our state guidelines, our voluntary guidelines. Next slide, please. So some of the things that we've learned and that I really want to pass on to y'all is that don't be afraid to try something out. You know, if you try it once and it doesn't work, oh well. But if you try it and it does work, then you've really got something to run with. Using it as a pilot gives you the opportunity to do some fine-tuning. We have SOPs that go with all of these. Matter of fact, we're still working on our SOP for our limited scope inspections, even though we have started them. And then the other thing we've really found on our feedback is that these announced inspections are really working out very well as a compliance tool. We've really found that our operators are more engaged and that it's teaching them how to look at their operations. It's really moving us all toward that goal that we've all been talking about for years and years of active managerial control. You know, they're there every day. We're not. And this is helping them learn what we do. Next slide, please. So what are we going to do with it in the future? Well, so far we've already expanded it to include our change of ownership inspections, because what we do is we do a virtual permit inspection and a food safety or limited scope inspection at the same time. So that's keeping our inspection program going, or our permitting program going. And we also see where it can be used for other announced inspections, such as follow-ups and any that they know that we're coming ahead of time anyhow. So once we do start doing on-site routine graded inspections again, I can very much see us doing this for follow-ups. It was mentioned earlier, plan review. We call them pre-operational inspections. I could definitely see us using these for pre-operational inspections to save that drive time, because we send more. We got a big state, and we got people that cover large territories. And again, we are a state-based program, so it might be somebody from the Florence office having to drive to Sherrall, which is about a 60-minute drive, to do a site inspection. This would really help us out to do a virtual inspection instead. But again, and continuing to use these limited scope inspections as a way between routine inspections to help provide compliance assistance. Next slide. And that's it in a nutshell. I do encourage you to go to our website and look at some of the stuff that we've got up there. We do have a video of a virtual food safety check being conducted, so you can see what it looks like if you haven't seen that already. And my timer says I'm out of time, so next person gets it.
Thank you, Sandra. Next up, we have Christopher Smith, U.S. Food and Drug Administration. Chris?
Good morning and afternoon, everyone. It's such an honor to be invited to participate on this panel, and I've greatly enjoyed hearing the other presenters and how retail food programs across the country have adapted and persevered through this ongoing public health crisis. My part of the presentation will focus on the Office of State Cooperative Programs, which is the field component of FDA's National Retail Food Team. When the pandemic hit, we suspended all field work and travel to protect the health and safety of our employees. We've learned a lot about doing things remotely, and we've made great progress on non-field initiatives over these last few months. We're all looking forward to the day when we can get back into the field, but we're committed to being as cautious as possible to protect our employees as well as our stakeholders. The pandemic changed many things about our day-to-day operations. It's been stressful for everyone. Despite that, it has given us a chance to focus our energy in different ways and seek innovation in how we accomplish our mission. I'm happy to share some of the work we've been doing in these last few months with you today. Next slide. When I think about our Office of State Cooperative Programs, these are the three words that came immediately to mind: partnership, collaboration, and multiplier. We are all about working in partnership and collaborating with our stakeholders, both internally and externally. In addition, since we have such a limited number of staff, we rely largely on the multiplier effect to have the greatest impact to achieve our mission. Next slide. This slide shows the depth and the breadth of the work in the retail program. The map shows all of the jurisdictions that are currently enrolled in the FDA retail program standards. The chart in the middle displays the approximate number of retail jurisdictions and food safety professionals from across the country, and the right gives a sampling of the technical support that our retail food specialists provide. As you can see, it's a huge support list for our retail food specialists. Because of that, we rely on the multiplier effect to have the greatest impact on what is provided to the most jurisdictions and people possible. Our specialists have been greatly challenged during this time to provide the support needed to everyone. They've absolutely risen to that challenge through information sharing, both internally and externally, and collaboration. Next slide. Now I wanted to talk a little bit about partnerships and collaboration, which includes work with both internal and external stakeholders. For internal stakeholders, our closest partnership is with the other component offices of our National Retail Food Team. This includes our Center for Food Safety and Applied Nutrition, which is our policy arm, Office of Partnerships, which provides funding support, and Office of Training, Education, and Development for training. We all have different roles and responsibilities, but work seamlessly towards a common mission. As you can imagine, the pandemic has made this type of communication even more critical as we've worked with the other three offices on how to adapt and meet our stakeholder needs. In addition, our National Retail Food Team has been collaborating on a new strategic and operational plan, which we've been working diligently on prior to and throughout this pandemic. Next slide. One of our biggest external partnerships is with our Retail Association partners. This is embodied here through our Retail Regulatory Association Collaborative Group, which includes members from AFTO, NEHA, NACCHO, Conference for Food Protection, and CDC. This group was formed last year as a more structured way to share resources and work collectively towards common goals. Despite COVID, this group has continued making progress on a lot of key initiatives. Next slide. I also wanted to take a minute to mention our newly unveiled New Era of Smarter Food Safety. The rollout of this was delayed due to COVID, but work has been ongoing throughout the pandemic. FDA has developed a blueprint that outlines a path forward that builds on the work that we've done and will continue to do to implement the Food Safety Modernization Act. The blueprint, which was literally shaped by thousands of stakeholders who provided input, represents a commitment that FDA makes to the American people to do all we can, as fast as we can and as effectively as we can, to ensure that we have the safest food system in the world. This is an agency-wide initiative, and we are so excited to have a large role in it for retail. Next slide. For our Office of State Cooperative Programs specifically, this is our team. You see our leadership on the left. That's a partial organization chart of our division, or our office. On the right side is our retail food specialists, who are the linchpin of what we do. They are the engine behind what we can accomplish here, and I've never worked with a more committed and hardworking group of professionals in my life. The pictures show our specialist team at the end of last year. Since that time, we've had 3 retirements of Cindy Kunkel, Mario Seminara, and Lisa Whitlock. Next slide. While we will miss them greatly, I'm excited to announce that we've been working on interviews and selections of 5 new retail food specialists. We anticipate final offers and announcements will be made for these specialists in the coming weeks. We're excited to add their smiling faces to our team. Next slide. In addition to those initiatives, I wanted to provide some other updates on items of interest. The list you see in front of you are some of the things we plan to do this year and have been making adjustments to. One of the primary responsibilities of our retail food specialist is to meet with jurisdictions and provide technical support and training when needed. Since COVID hit, we suspended all travel, so we've learned a lot about doing things remotely. We've moved everything possible to phone or webinar, so our specialists are able to continue providing the support needed during this difficult time. Conference for Food Protection was postponed and has been rescheduled for April next year. Despite that postponement, we have been preparing throughout this time and we'll be ready to participate whenever it happens. We also had 5 retail food seminars around the country scheduled this year, as we normally do. Due to COVID, each of these has been postponed until 2021. We are exploring the possibilities of doing something virtually to help meet needs and stay engaged with our stakeholders. As many of you know, we also send specialists out in the field to collect data on foodborne illness risk factor occurrence. This is something that was immediately suspended due to COVID, and we are currently exploring options on this as well. However, over the last several months, our risk factor study work group has been working on a report for the 2015-16 data collection period, and that is currently going through the review process. We look forward to sharing that with you. We also traditionally send a team to provide training and field supports to each of the national political conventions. This is mission-critical work, and we remain committed to doing this. Despite that, we have been challenged with the ever-changing landscape, and we are committed to ensuring that our specialists are properly protected. But we are still committed to going there, to providing training, although we are certainly challenged by how that has changed over time. Field standardizations that we normally conduct have been put on hold as we assess how to resume those safely. We're currently evaluating how to do that and also thinking about how to prioritize work like that once we are able to get into the field. As mentioned previously, our specialists are continuing to provide technical support on the program standards remotely. We know that your progress on initiatives such as standardization and program standards has likely been set back due to COVID. That is completely understandable, and we are in the process of evaluating how best to provide needed flexibilities due to that. We're having a lot of discussions around that topic and expect to provide some guidance in the near future. Next slide. On the last few slides, I wanted to mention a few exciting initiatives that our National Retail Food Team work groups have been working on. The first is development of and implementation of certificates of recognition for program standards achievements. These would be awarded to jurisdictions for milestone achievements, such as meeting standards. We're excited to get this rolled out to help provide all of you some additional recognition for the great work that's been done around the country. Next slide. Next slide. This is a screenshot of our Retail Food Program Standards Resource Center. This is administered by FDA and is intended to foster collaboration among retail food regulatory programs by enabling the sharing of tools, templates, and documents that have been developed by our state and local tribal territorial partners. Highly recommend that you utilize this. Your retail food specialist can get you access if needed. Next slide. Also wanted to quickly mention the quick reference guide has been developed by our internal work group for using the sites. I think you'll find this helpful in navigating. This is located on the site itself, and of course our specialists always stand ready to assist you when needed. Next slide. I also wanted to mention our risk factor study database that is available to jurisdictions. We rolled this out earlier in the year, right before the pandemic hit, in partnership with the Food Protection and Defense Institute. It provides a mechanism for our jurisdictions to customize their data collection forms, input information, and run reports to help them assess the occurrence of foodborne illness risk factors within their jurisdictions. Again, our retail food specialists can help you learn about this and get set up with it. Next slide. Finally, I really wanted to take a minute to provide a very sincere thank you to everyone on this call. We're dealing with the most significant public health crisis of our lifetime, and I couldn't be prouder of our profession and the amazing work that everyone has been doing in the most stressful of circumstances. Thank you very much. And that is it for me.
Thank you, Chris. And thank you to all of our speakers for your presentations. We are now at the portion of our call where we would like to take new and follow-up questions from our callers. So I'm going to ask the operator, Angela, to provide instructions to you on how to give those questions.
Thank you. We will now begin the question and answer session. If you'd like to ask a question, please press star 1, unmute your phone, or record your name clearly. Once again, to ask a question, please press star 1.
So Maria and Pat, while we're waiting for the questions to come in, we had a couple pre-submitted questions, and I just want to thank the panel for an outstanding series of presentations today. And, keeping it succinct, but really, just drilling down to the finer points of things we need to know and think about. For those of you, I think I want me to know, Doug, Rachel, Sandra in particular, you talked about virtual inspections, virtual food safety assessments, virtual food safety checks, whatever you call them, those tools, those techniques. Lessons learned and applied is kind of my big driver is, now that you tried it out and did it, what lessons have you learned, maybe from the standpoint of the recipients getting the inspections and the people doing the virtual inspections, and what things would you change going forward?
This is Sandra. I would say that the biggest surprise we learned, because I will tell you, most of my inspectors were very skeptical to start off with, was once they started doing them, they were surprised and pleasantly pleased at how receptive the operators were and how good of the communication was, and how they really felt like they were making some positive contact with people that maybe they hadn't had real positive relationships before. Now, there are challenges, of course. Again, you do run across problems with reception occasionally. You'll go in somebody's walk-in cooler and drop out, or they'll drop out. And we've had to find some workarounds for those situations where we've told them, okay, take a picture or shoot me a little video and send it to me after the inspection for me to review. So you do, I guess the biggest takeaway is you've got to be flexible on how you work with these things. You don't always get to use all the platforms that you'd like to use because of IT concerns and firewalls. But again, it really has, I think, developed more of a it's not us against them anymore. It's us working together kind of attitude.
Hi, this is Doug with Public Health Seattle King County. And I think so. Some of the feedback I'm receiving from our inspectors is that I think they miss the interpersonal communication that's afforded in the normal sort of inspection model that we're used to. However, I think what we're looking at is how can this be a beneficial educational tool going forward? And I think there's a place for it. Obviously, this is not a replacement, I don't think, for the way things used to be, and hopefully the model that we'll get back to. But I see it as, as someone who leads our foodborne illness investigation team within King County, I see this actually as a beneficial tool when we're doing the follow-up portion of foodborne illness investigations to, for example, verify if we're doing a norovirus investigation, to verify cleaning and sanitizing, where we can actually take the time at some odd hour of the day because an operator is motivated to get reopened again, to have that virtual assessment so they can demonstrate to us what they've done to minimize any environmental risk. So I think what's been revealed in this is that it's going to be a useful tool. We have a skilled set of investigators who are adept at creating educational videos and utilizing this platform, and I think it's only going to benefit us going forward. Having said that, I think a lot of us are just kind of ready, if you will, to get back more to the kind of inspections which allow us to be there communicating with someone. And particularly in King County, we have a multitude of languages that are spoken. And we have no less than 18 different languages spoken among our investigators. And I think they miss being able to communicate in ways that just can't necessarily be accomplished through the filter of FaceTime. And so we're ready. I'm sure a lot of you are ready, but at the same time, I think we've learned, there's a power in this tool that can be utilized for a lot of different purposes.
Thanks, Doug. We've got a question that came in through our chat here. Have any of you had any challenges with compliance due to low supplies of masks or gloves? How are you helping industry overcome some of these challenges to make sure they have masks and gloves for their workers? Anyone want to jump on that one?
This is Alexis from Southern Nevada Health District. We actually had a request from one of our vendors in town to do a meeting with us. And during that meeting, they were actually asking these kind of questions, like how can we help our local businesses? And we were actually trying to help them figure out what type of supplies our businesses were going to need. So we were kind of looking at it from that perspective, what the vendors in town could do to help the business owners.
Great, thanks, Alexis. Anyone else want to respond to that on the masks and gloves issue? All right, we got another question that came in across chat here. For those that are conducting virtual inspections, have any of you utilized translation services? And if so, how has that worked for you?
So this is Rachel from Alexandria. Yes, we've used translation services. I would say the best translation service that we had was our in-house staff actually translating information and then getting somebody else to proofread it and translate it back. Some of the professional translation services, unfortunately, whilst the word is translated correctly, it kind of misses the messaging behind the individual word, if that makes sense. So we've kind of had mixed reviews from our professional services.
Thanks. Anyone else want to respond? All right, not hearing anybody. Do we have any questions queued up currently?
Yes, we do have a couple of questions. Our first question comes from Shelby. Your line is open.
Hi, good morning. My name is Shelby Calvillo. I have a question for Alexis. Alexis, I work for Aria Resort and Hotel here in Las Vegas. I was just wondering, with the food handler cards, do you expect that there's going to be an increase in foodborne illness outbreaks or bad habits with our cooks and any other outlet? Just because we don't have the food handler card, and they've also been off of work for 3+ months.
Hi, this is Alexis. I think your question was about food handler card requirements being temporarily suspended. That's true. Through September, or maybe even through the end of the year, we're not going to be offering our food handler safety training card. We actually rely more on food establishments to do a lot of their training for their own people on site. So I think you were saying, do we feel like this might result in increased occurrence of foodborne illness? I would hope not, because I would still expect that the managers and people in charge in our food establishments are still going to be doing that training for their own staff. And as I mentioned during my presentation, our inspectors are still going out and doing routine inspections. So you could still see an inspector out there in your food establishment doing our routine check for all of our food safety and sanitation practices just like before. None of our regulations have really changed or gone away, even in the midst of this pandemic.
Oh, yes, definitely, for sure. Thank you so much. And we have actually seen our inspector already. She came on 4th of July. But I have been seeing some bad habits with our staff in general, just because of the food card, and they've also been off. But, I mean, we're working on it, but I was just wondering if you had seen the trend with any other establishments in Las Vegas.
No trend really on increased foodborne illness reporting at this time has been noticed, no.
Awesome. Thank you so much.
Thanks.
Our next question comes from Keith. Your line is open.
Can you hear me?
Yes.
Hi, my name is Keith Jackson. I'm with Performance Food Group. I've got, first of all, thanks everybody for taking your time to put this together. This has been fantastic, lots of good information. The virtual activities are very exciting. We are doing some of this type of stuff in industry as well. I work for Performance Food Group. We're a major food distributor. My question is for the team. It's a little bit directional. I know that we've had a lot of focus with retailers and food service establishments, about mask utilization, hand washing, social distancing, proper disinfecting. Those 4 things are very, very easy to train operators on. As this evolves, and restaurants and retailers stayed open, right? As we see folks coming back to work who may have had a positive COVID test, directionally, how do you feel we will go in terms of the contact tracing requirements? I guess my specific question is, do you see it becoming a requirement for retailers or food service establishments to report positive COVID tests to health departments? Will this remain in the medical community? Just directionally, how do you feel like that's probably going to go for us? Because this is changing so much, and so many questions come in. We just want to be prepared for that kind of activity. Thank you.
This is Sandra, and I'll try to answer that for you, although I will tell you that it's going to vary from state to state, jurisdiction to jurisdiction. But in South Carolina, it would require a regulation change before that would become a reportable. It is a reportable disease in South Carolina, but it is a requirement that the medical provider contact DHEC. It is not a requirement for the employer. it would take a regulation change for us to put that into our food code before you would be required to do that.
Thank you.
Yeah, Keith, this is Barbara Cassens. We'll put my FDA hat on. From the Food and Drug Administration standpoint, I don't think we've made a decision federally on that. So Sandra's actually right. It would be a state-by-state requirement, if at all.
Thank you very much.
Do you have any more questions in the queue?
Not at this time.
Barbara, do we have any others that we had?
Yeah, I think I had one or two over here. Let me pull it out here. For the panel, talk to us a little bit. I'm going to change this to more of a worker question. Working from home, emotional challenges, personal challenges. I personally have been working from home for a long time, and the office partnerships, many of our staff are located virtually and work from home. So we've developed our process for that. But did you run across that initially when COVID pandemic hit, and how did you deal with that? How did people cope? Not just equipment needs and technology needs, but even just the emotional needs of I've got kids at home now, I've got a spouse at home. Personally, I have 4 cats crawling on my computer half the time. I mean, just how do you deal with all of that?
This is Sandra. I'll give you a brief overview of what we've done. We've been using Teams, Microsoft Teams, and using that to have our staff meetings, and we do it every day. Our teams get together, and they'll have a team call, and even if it only lasts for 30 minutes, it still lets them have that interpersonal contact with their fellow staff members, and I think that's really important. And we're rotating people in and out of the office too, of course, but still, I think it's important that you stay in touch either by phone, by text, by email, because we've had some personal challenges occur in our office during this time period too. A couple of tragedies, things like that, where everybody needed to know what was going on with a fellow team member and express their concern for their well-being. So I think it is really important to have those virtual meetings so you feel like you're still talking to real people instead of your cat that's crawling across your computer.
Thanks, Sandra. And I have to let you know that my 17-year-old cat named Zeke is trying to be my personal assistant right now, and it's just not helping.
I have a new kitten that tries to do the same.
This is Rachel from Alexandria. I would just echo what Sandra said. We have routine meetings, and it's interesting because before the pandemic, we had virtually no capability to have online meetings, and now we have a whole array of different platforms that we can use, and it's amazing how quickly we were actually able to pull off what was almost impossible before a pandemic. So sometimes there is a small silver lining to this awful cloud that we have.
Thanks for that. We do have one more question that came in through chat. I think this one's probably going to be headed towards you, Rachel. What was the incentive for businesses to sign up for the ALX Promise?
That's a great question because I didn't have time to cover that in my presentation. So any business that signed up for the program and went through the entire program and sent back their pledge and checklists and employee training records to us actually got one of our stickers to display in their window that said that they were participating in the ALX Promise. But perhaps more importantly, they also got to go on our Visit Alexandria website as one of the businesses that had fulfilled the requirements. And Visit Alexandria is hugely involved with the tourism in Alexandria. So being promoted for free on that website was huge to many of our businesses.
Great. Thanks, Rachel. And for any of the presenters that have dabbled with virtual inspections in their programs, we have a question. Do you think virtual inspections will become a standard option for inspections in the future?
This is Doug with King County. That's a good question, and I know it's something we're sort of bouncing around. I don't have a definitive answer, although I'd probably lean towards no. But that has to be a data-driven answer for us going forward. So I think that just sort of some of the comments that I've received from our staff are they prefer to do the traditional in-person model of inspecting. However, I personally think there's a place for it in certain situations, but time will tell. I think right now it's difficult for all of us to have some breathing room to take a step back and assess things in sort of a comprehensive manner, but hopefully at some point we can, and if indeed we choose to have that as a component, and I don't just mean us, but I think all of you, it'd be interesting to sort of, drive it to a place where it becomes, I think, as comfortable for us as doing in-person inspections. But I think time will tell. So even now we're not doing as many food safety assessments as we were doing in March and April because the status of our staff has changed somewhat, so that there's a real sort of requirement, I guess, to actually get back out in the field in some manner. So it's complicated, and I think it varies between state health departments and local jurisdictions like ourselves. And so I think it's something that's going to be worth visiting more in depth and finding out if it's a viable option.
Thanks, Doug. Sandra, any thoughts? Virtual inspections here to stay in South Carolina?
They are here to stay in South Carolina. I can tell you that my upper management is way excited about some of the ways that we can use it, again, to address some of we're real thin spread out, and it's not going to replace a routine inspection. I don't think there's any way we can do that, at least not at this time. We're going to have to get a whole lot more knowledge and a whole lot more of these under our belt, which, by the way, as of today, we've done 7,406 virtual inspections in South Carolina since we started. And we're learning. Every one of them we go to, we learn. But, again, follow-up complaint, pre-operational inspections, and then, again, for those, we have an enforcement system here in South Carolina where we do consent orders and we fine people, maybe as a compliance assistance tool before we get to that point with somebody, between those routine on-site inspections. If we can do a virtual inspection with them and help them learn how to do proper cooling, to monitor whether or not they're following up on their date markings, to walk them through some of the places that they've had problems. It can be a huge tool and a time saver for everybody. We can be in there when they've got, virtually, when they've got time for us to be there, and we don't have to drive 50 miles out in the country to get to them if they've got the technology available. So, yeah, there's a place for them, and it will continue to expand as we go forward in time.
All right. Looks like we have one last question as we wrap things up here. We're coming to the top of the hour, and I know folks have other things to do, but I'd like to get this one in. We've had requests from our local health departments in Maryland to have virtual inspections count as a routine mandated inspection. Are any other states getting this request or looking into this possibility? So I guess for those states that are doing virtual inspections, are you counting them for now as your routine on-site mandated inspection? I think, probably limitations in getting to the facilities, you probably have to consider some of those options now, but is that something that will continue on?
So this is Rachel in Alexandria. So our virtual inspections are counting as our routine inspections right now, which was another reason that the Promise program worked quite well, because we were able to do both activities simultaneously. They are counting in Virginia.
All right. Well, with that, I think, Maria, we'll turn it back over to you to wrap things up.
Okay. Thank you for joining us on today's webinar. We hope that you found it helpful and informative. A copy of the recording and the presentations will be posted on the PFP website. If you have any additional follow-up questions or comments, you can email them to us at pfp@fda.hhs.gov. And that concludes today's call. Thank you all for joining us. Angela?
Thank you for your participation in today's conference. Please disconnect at this time.